So I'm certified by two different medical boards. There's the American Board of Otolaryngology, that's the ABOTO, and then the American Board of Facial Plastic and Reconstructive Surgery, that's the ABFPRS. So otolaryngology means ear, nose, and throat. That's surgery of the head and neck, versus facial plastic surgery is what it sounds like. It's basically plastic surgery that involves the face and neck, essentially. So to become board certified in otolaryngology, people complete a residency program, which is after medical school. That's 5 more years of training. So most people start around 26, 27 when you're done with med school. 5 years of residency where you're working in the hospital. You have increasing level of responsibilities as you work your way up the ladder to becoming a chief resident. So after those 5 years, then you have to take a board examination that you pass that is a test of everything that you've learned during residency. So once you pass that exam, then you apply for board certification. They review all your credentials and then decide essentially that you're board certified in otolaryngology. And then in facial plastic and reconstructive surgery, so I did a fellowship after my ENT residency. So meaning when I was 30 and up to my age 31, I did a fellowship in Beverly Hills, specifically in facial plastic and reconstructive surgery. After that, I also took a board exam in facial plastic surgery. And then you also have to submit 2 years worth of surgeries that you do after you've completed your fellowship. There's a board that reviews all of that material, and then they award a board certification. So that process usually takes about 2 or 3 years from the time you're done with your training. So the board certification basically implies that you have the training and experience and that you have passed the examinations to determine that you're qualified to be doing the kinds of surgeries that we do. It adds an element of sort of credibility, confidence in your surgeon, just knowing that they've been through that process of training and all that. And then the other important thing is for what I do, where I specialize in rhinoplasty. The great thing about being board certified in both otolaryngology or ENT as well as in facial plastic surgery is that I have a lot of experience both with the functional part, which is the deviated septum, the valve repair, the turbinates, sort of improving your breathing that comes along in the ENT experience, and then the facial plastic experience, which is the change in the external appearance of the nose. So I think to really have skill in rhinoplasty, it's really important to know both the inside and outside of the nose. So having a surgeon who's board certified and trained in both function and form, I think is super important when it comes to rhinoplasty in particular.